Does anyone else feel like respiratory diseases were super confusing in nursing school? We spent so much time looking at pictures of blue bloaters and pink puffers, and honestly, it just made it way too complicated. I'm going to break it down to make it really simple. In obstructive lung disease, we have a problem with air trapping. We can't get the air out. There is an obstruction to airflow. One example of obstructive lung disease is COPD, chronic obstructive pulmonary disease, and there are two subcategories of that. We have chronic bronchitis and emphysema. This is what a normal bronchiole should look like. Bronchioles are the little tubes that transport air between your lung and your trachea and eventually the atmosphere. In chronic bronchitis, the little bronchioles are chronically inflamed and full of mucus, and air is getting trapped distal to them, past them in the lung. In emphysema, we have damage to the alveoli themselves. So instead of the little sacs being perfectly defined little grape clusters, the breakdown of the alveolar walls makes them extremely inefficient, floppy, hyperinflated, and gas gets trapped in these clusters. Not being able to get the air out means you can't ventilate effectively. In restrictive lung disease, we have a problem getting air in. Restrictive lung disease can be broken down into two main categories: intrinsic causes, meaning a problem with the lung tissue itself, or extrinsic causes, meaning there's something outside of the lung that is preventing the lung from expanding. So the main cause of intrinsic lung disease are interstitial lung diseases. Some sort of a problem with the interstitium, which is the space between the alveoli itself and the capillary. There are tons of diseases that fall under this category, but what they all have in common is there's some sort of inflammation going on in the lung tissue, in the interstitium, that causes permanent scarring and fibrosis. So the lung loses its ability to expand. And in severe enough cases, this can also cause a problem getting oxygen across the alveoli to the capillary, some sort of a diffusion impairment. This can be due to things like severe pneumonia, some really big bag medications, radiation therapy, diseases like sarcoidosis, idiopathic pulmonary fibrosis, the list goes on. With extrapulmonary restrictive lung disease, something outside of the lung is preventing the lung from expanding into the chest. So this could be fluid buildup, like a pleural effusion, fluid between the lung and the pleura. It could be a big belly pushing the diaphragm up into the chest, like ascites when patients have severe liver failure. It can also be a severe case of scoliosis. There's several causes of this as well. We dive deep into all things respiratory in the Confident Care membership. The obstructive lung disease lecture is already up. I just finished recording restrictive lung disease today. In the meantime, let me know if this video was helpful to you. Drop your questions in the comments below.